Hello, everyone. My name is Bhagvat Maheta, and I'm a first-year medical student. My team and I have been working on a project titled Location Matters, the Geographic Impact of Plastic Surgery Residency to First Job Placement. And we are very excited to share our findings with you. So the residency location may influence the location of a resident's first job, and there's many different factors that may contribute to this phenomenon. For example, the type of practice or the specialization that a resident wants to pursue may impact where they end up choosing to start their first job. Additionally, family life choices that may have come up after residency, during residency, or even before residency may impact where they start their first job. And so this may play a confounding factor in the residency match process, especially in lengthy residency programs, such as the integrated plastic surgery residency, where medical students might be interested in knowing how does the location of their residency impact the location of their first job. And so that's the exact question that our research team was interested in looking at. So in order for us to do this, we looked at all the data available to us from 2015 going to 2021. We identified graduates from integrated plastic surgery residency programs in the United States specifically that started their first job upon graduation from residency. And we considered factors such as the proximity of the first job directly to the location of the residency. If we look at the pie charts in Figure 1, we can see the geographic breakdown of plastic surgery residency and first job locations. In the left picture, we're looking at the plastic surgery residency locations from our 279 residents we had in our sample size. We see that a predominant number, 43.3% of our residencies were in the north, while the South and West had about 20.4% and 23.6% respectively, with Midwest having the lowest percentage distributed across the United States. If we look at the first job location, we see a fairly similar trend. The North has 33.9%, while the South, West, and Midwest are more distributed equally with approximately 20%. And we see that very few of our residency graduates actually go internationally to pursue their first job, approximately 1.1%. So now if we look at Figure 2, we're looking at the geographic breakdown of relative first job location compared to the residency location. So we're essentially looking at what was the distance of the resident's first job location in reference to their residency location. So here we see that 191 residents, or 68.5% of our sample size, stayed within the same geographic area after leaving their residency and starting their first job. What's more surprising is that 53.9% of those who stayed in the same geographic area, which is 109 of our residents, actually stayed within 100 miles of their residency location, which suggests that they were staying either in the same location, in the same institution, or in a nearby hospital within a 100-mile radius. To statistically quantify this, we used chi-square analysis, looking at the expected value if distributed evenly across all United States and international geographic locations, and what we actually observed. And here we see that the chi-squared value, which was much greater than the critical value, suggesting that the distribution of where the residents pursued their first job was actually not due to chance, but rather there is some other factor leading to more residents staying in their same geographic location for their first job. And so the literature suggests potential reasons for why this might be occurring, some of which include that the residents have already established their network in the area, or they've shifted focus to family life, or due to the variety of opportunities for different types of practice, which may be influencing where they're choosing to pursue their first job. And this study has implications in terms of students applying for residency, but also having them consider their residency location based off of their first job location, since first job location may influence the trajectory of their career. Future directions for this project include qualitative interviews to understand what factors actually drove residents to pursue first jobs in certain locations versus others, and that would give us a more concrete idea rather than hypotheses. And also looking at the first job location relative to where the surgeon is going to spend the rest of their career, as that may also be of interest to a lot of students, trainees, as well as faculty and staff. Thank you so much for listening. My references are in this QR code, and if you have questions, feel free to reach out. Thank you.